everybody. Today we are here at the LINNC Miami, LINNC Americas 2024, and we have the honor to be with Professor Alex Berenstein from New York, United States.
Thank you, Dr. Rivera. How are you?
Fine, thanks. Dr. Berenstein, how do you perceive the future of interventional neurology and the veins, the relation of future and veins?
I think it's just fantastic. You know, as I was saying, up to now, we've been going through the streets and then the highways and then the freeways, which are the arteries and so on. Now we have a new access, which is the sewer system. So imagine if you are in a city and you're trying to travel from place to place and the streets are all congested or what have you. If you can go through the sewer system, you actually probably are safer. You probably can get to farther places, and we're going to be able to do incredible things. For example, treat the cancers by injecting medication in the venular. Because remember, the arteries are not what you eat from. The venules is really where the interaction exists and where food goes in, and when the sewer system goes. So I think it's going to be a fantastic thing. I also can see we can do stimulation in the brain. You know, going through the venous system, it's already happening now. You know, but now we're going to be able to navigate. So this is the next frontier to conquest. Up to now, we've been using tools that were made for arterial navigation, and we're trying to adapt them to venous navigation. Imagine if we start taking tools that are specific for the veins. They have a different strength, and they have a different elasticity. You know, an artery can expand 8 times to 1. A vein can probably 16 to 1. So there's going to be a great future.
So do we need a new knowledge for veins? Because we're more used to arterial knowledge or anatomical speaking, and now we see today we see with Dr. Rivera that there's a profound knowledge that we have to advance.
I think what Pierre and Jacques did was called functional anatomy. What I did with Pierre was using the functional anatomy that he described in the normal, and how do we use it in the pathological circulation. So I think the collateral venous system is going to be a lot more complex than the arterial collateral system. See, the arteries, you have the big connections, the anterior communicating, posterior communicating, but then you have the smaller connections, leptomeningeal collaterals. In the venular system, you actually have also things that go from the superficial venous system to the deep, and they all connect. It's like a system that is 2 or 3 alternatives, because you have a venous ganglion malformation. So the deep venous system is not functioning, but the brain is fine because it gets the superficial venous system. So I think we're going to learn not only the anatomy, but the functional anatomy. And then we're going to learn that certain cortical veins have a different ability to metabolism than the sinuses, for example. There's going to be a completely different. So it's a fascinating thing. I mean, I wish I would be able to live for another 500 years and see what happens. I mean, even the imaging will be different. Yeah. You know, the timing of the day. So it's just a great future.
I'm talking nowadays the development of the venous approach for AVMs.
Finally, we conquered that disease, because with the transarterial, we were able to close fistulas, but treat AVM to really get a cure was not so easy. So now the venous approach is the way we have finally. Endovascular treatment is becoming the treatment of choice of AVMs because we can cure them by a transvenous or combination.
And you talk about developing new tools. What do you think is going to be the new tools for venous? Or
I think articulating technology. You know, there's no question. The whole catheterization. When I started, we got tubes of plastic, and then we cut them and we steamed them and we filed them, and then came on catheters and construction of catheters that don't collapse. Because if you put in a coil and the catheter is in a curve and the catheter collapses, the coil gets stuck. So there was a need to create that kind of engineering. When we're going to be traveling in the venous system, the ability to imagine the nose of an elephant. They can actually go look. I mean, I can see if you put a little camera, there's micro cameras now. You can do articulating technology with multiple lumens, and one is actually visualization. The other one could be injection, of course, or injection of medications, or injection of medicines. So this it's going to be fantastic. But I think that what I call articulating technology is the future for the vascular navigation.
What would you the message from you for the young generations that are entering the world of functional?
Oh, I would say without any question, look into the anatomy, because the anatomy has not changed. No matter how much technical advances we have, the anatomy remains anatomy. But let's learn it with a better understanding of how it relates. The anatomy that I was taught in medical school, you have the external carotid between 12 and 14 branches. It was crazy because there was so much variation. Pierre came out with functional anatomy. Instead of looking from the center to the periphery, we look from periphery backwards. You got a nose, you got to receive blood supply to the nose. It doesn't matter if it comes from below, it comes from the middle, or it comes from above. But if you understand that, you can then retrace and rebuild the anatomy of every individual. If you had a stenosis, if you had a ligation, if you had a coil, it alters everything. So for young people, anatomy would be super, super basic. But I think we're gonna be doing epilepsy. We're gonna be doing oncology. The oncology is just the beginning. Remember how advances in the liver, how advances in the prostate? We're gonna have the same because we have the access to the body. We have a very elegant access it's one of the best specialties in medicine. But I'm a bias, obviously.
Thank you, Professor Paul.
Thank you.
Thank you.
Rodriguito,
Muchas gracias.
para servirte.